Joe. Welcome back.
Hey, Frazier, it's good to see you. It's good to see you.
I know it's been a long time.
This must mean the legislative session is coming up since we're talking again.
It is. I feel like I'm the Jets and you're the playoffs. It's been a long time since we saw each other, right?
A long time, a long time. Well, well, since it's good to see each other and good to hear each other's voices, let's jump right in. We're kind of reigniting the healthcare headlines. This edition is going to be called the Post Super Bowl Legislative Session Kickoff Program of three headlines, three healthcare headlines you need to know. So if anybody remembers from last year, we would kind of meet every week and discuss different things that were happening in Tallahassee and how it sort of impacted the medical community across the state of Florida. So that's what we're going to do today. We're just going to kind of give a preview of what people can expect, in the months and weeks coming up. So you ready to jump right in?
Yeah, I am. It's going to be a fun year. There's a lot of freshmen, rookies, up there in Tallahassee. So we're going to talk a little bit about what to expect as they participate in their first legislative session and kind of what that means for us as well. So looking forward to it, Joe. Let's roll.
Yeah, and as we saw in the Super Bowl, rookies can make a splash. So it's exciting to have some new names, new faces over there. So starting with number one, like we do with each one of these installments, we have three different topics. The first one, while the action on the field in New Orleans was a bit of a snoozer, there have recently been some fireworks over in Tallahassee. Can you share with us what is going on up there and how that will impact the upcoming session?
Yeah, thanks for that, Joe. It certainly is something we need to be, or everybody's been watching, but something we need to be aware of as we start to participate in this year's session. But there's been some back and forth between the governor's office and the House and Senate leadership. It started in January over calling this special session. It seems like as of last week, they might have, or this week actually, they might have patched up some of their differences. They did call another special session that they're working on passing an immigration bill. It seems like all parties have come together and agreed to, but it got kind of fun there for a minute. There was a lot of back and forth on social media, with allies of both the governor's office and the House and Senate leadership, going back tit for tat a little bit on the social media channels. But it looks like things are coming together. But typically in an environment like that, where the leaders, the three big leaders in the state, aren't seeing eye to eye, it does make it difficult for them to pass kind of meaningful, controversial legislation in the state. It's obviously a much easier environment when the three of them are getting along. So we'll see what that means in the coming months. And if there are any of those controversial issues that start to percolate up to the top, if there will be alignment amongst the leaders enough to get something across the line. But it is something in the back of your mind that may travel throughout session, just a theme that we need to follow and be aware of moving forward.
And so that kind of stuff, that's pretty normal. You see that, kind of social media chatter every year. Is that not normal?
That is not normal. Yeah, so that's why it caught some attention. It's not normal. Obviously, typically any of those disputes are usually had, behind the scenes, behind closed doors. It was a little bit more public than normal, these days. So, anyway, it seems like they've gotten past it now, and we'll kind of see if that camaraderie that they reached this week will follow through the rest of the session.
Okay, we'll keep an eye on that. We'll keep an eye on social media. We'll keep an eye. We'll talk to some people behind those closed doors, and we'll see if we can get a little info. So moving on, that's pretty exciting first start. The second topic we're going to talk about today, well, we saw the one dynasty fall at the Super Bowl. Seems like the health insurance industry shows no sign of giving up their dominance at the state capitol. What are the prospects of patients and physicians getting some relief from the health insurers this season?
Yeah, thanks for that, Joe. Yeah, unlike Travis Kelsey, the insurers show up every year, right? They're always on the field and ready. Um, and this year will be no different. And because the fact that this is the first year for many legislators up there in Tallahassee, it's usually more of an experience for them getting their feet wet, figuring out where the bathrooms are and how the process works. Typically, your first year, you're not seeing major pieces of legislation enacted. Obviously, physicians and patients have long been calling for some serious reform in health insurance, particularly around prior authorization and just access to the services that their physicians recommend. Obviously, we had that tragic death in the fall that sort of highlighted to an extreme level the frustration that many patients endure just trying to get treatment approved. We don't see this session any major movement on significant prior authorization reform, but we feel like there's an opportunity to address one issue that's been a long-running concern for our physicians, which is retroactive denials. There was a bill actually passed last year where the legislature gave the dental community a bit of protection from retroactive denials, and that retroactive denial is if you've gone through all the processes of getting prior authorization, you render a service in good faith based on the instructions the insurance company gave you, go ahead and render that care. Then they come back later and say, never mind, we can't pay you after all. And the physicians in a scenario are the ones holding all the bad debt and then going after their patients to pay for those services they thought were covered by the insurance company. Anyway, last year the legislature did provide the dental profession some protections. We think there's an avenue to get that extended to physicians this year, which would be a huge relief for patients, and something our physicians have wanted us to achieve for a number of years. So that, I think, in the realm of insurance reform is what we're going to be focused on.
Okay. Yeah, and it's interesting to see that when, doctors and dentists live kind of similar lives in certain ways, and we kind of see that in Tallahassee. They can kind of ride the different wave together. So that'll be interesting to keep an eye on as we move forward. Third topic, last topic we're going to talk about today, and it's something a lot of people talked about as far as the halftime show grabbing a lot of headlines from last Sunday. What healthcare movement is drawing the most attention as legislators return to Tallahassee?
So it's a movement not unique to this year, but it's been something they've talked about for a number of years, and that the physician community has been concerned with, and that is reform of the wrongful death statutes here in Florida. Florida is an outlier. We're the only state in the nation that doesn't let adult children sue for pain and suffering and wrongful death. That was put on the books years ago during the med mal crisis, just to make sure that we have adequate supply of physicians, in the state, and to address the unaffordability or unavailability of med mal insurance. So that statute's been on the books for a long time. It's become something that advocates have targeted in recent years to eliminate that prohibition, and to let adult children sue for pain and suffering. Um, the ramifications of that, if there's not some sort of counterbalance, is that you're going to have a larger pool of litigants in the state of Florida. They're going to sue for pain and suffering. So the obvious consequences, premiums will go up for physicians. We're in an environment currently across the country, but especially in Florida as well, where you've got these nuclear verdicts where the amount of money being awarded by juries has gone up like 350% in recent years. And the average jury award in general has gone up over 300% as well. So for the medical community, adding a number of litigants into this pool of who can sue and potentially have to be compensated millions of dollars, which might, be the right thing to do in the end. But the downstream impact of that is you're going to compromise access to care. The state of Florida has just spent a ton of money and resources in encouraging physicians to move to Florida. We're investing in our future physician workforce here in the state. So to pass something without a counterbalance that would then jeopardize all the good work we've done to address our workforce needs by making it more painful for physicians to practice here, or unable to stay or be unwilling to relocate to Florida, makes little sense given the amount of money we're spending to build up our physician workforce. So we hope if the legislature decides to go down this route of repealing that prohibition, that there is some sort of measure, some cap on damages or something that will make sure we just don't, at the end of the day, increase premiums so much that physicians start to leave again. So that is the movement, probably the number one movement we're concerned about currently. There could be more issues that emerge this session over the coming weeks, but currently out of the box, that's probably the number one thing we're concerned with that is going to be debated in Tallahassee this session.
Yeah, we need physicians in Florida. I mean, there's people are moving here like crazy, just the normal population, but I think everyone who works in the medical field knows that we need physicians here in the state of Florida. So we'll keep
Yeah.
an eye on all of that moving forward, and that is a very important topic.
Well, and I would add too that we often default to the courts being, the an appropriate venue to hold physicians accountable, if you will. But the Board of Medicine exists to take action against physicians that don't live up to the standard of care we expect in the state. And pulling someone's license at the end of the day is much more effective than suing them and having them just pay out money out of an insurance policy to a family as well. So there is other recourse that adult children can currently pursue in the state and make sure that unfortunate unforeseen situations don't happen to other families. It doesn't have to just be through the courts. So again, we're trying to find balance in this whole debate and make sure that we do have world-class healthcare here in the state of Florida, and we do respect the rights of everybody. So.
Excellent. Well, so real quick, obviously, you've been spending a little time in Tallahassee. I believe I'll be over there next week for a little bit. Things are going back to normal. Last year, things were earlier because of the election year and everything. Is it? It's kind of more of a normal schedule this year for the lawmakers.
It is normal schedule, so it's going to run the start of March. First week in March is when session opens. They'll go through the first week in May in general. So yeah, normal schedule. We've got doctor groups going up. We had the Physician Society of Central Florida this week up in Tallahassee, which was fantastic. Next week we've got some physicians from Duval and Dade and Broward and rheumatologists setting up there too. I ran into a bunch of surgeons this past week up there as well. So I mean, for doctors that are out there, administrators that want to get involved, reach out. We can definitely use you. You can help educate legislators. You're the people they want to hear from, not our lobbying corps. So it's important for you to engage in the process. And if you have that interest, just reach out and we can plug you in.
Yeah, and you always say, it's good to meet those lawmakers before you need them, and when you need to call their numbers, they know who you are and everything like that. So, sounds like a lot of exciting stuff coming down the road, and we'll keep our finger on the pulse, and we'll figure out what exactly is happening. Like you said, something's bound to pop up. We're bound to have some kind of breaking news throughout these weeks that we'll be covering. But any last thoughts before we say goodbye?
Now I'm just hoping since we covered football this time, next time maybe we'll do the real football. We'll have like a Champions League special or something. We'll talk Real Madrid and Manchester City or something like that.
I thought you were going to talk about the League with all the spring training venues here in the
Well,
state of Florida. We could talk sports every week. We could,
we
I'm
could.
sure there's a cricket match going on somewhere we can tie into all this as well.
Yeah, we'll take requests from the 10 people in the audience out there. Send
That's
in your
right. Yeah.
requests. We'll hook you up.
Put your comments in the comment section, and we'll try to tie everything into your favorite sport. Well, Frazier, it was as usual. It was great seeing you, and I'm excited about seeing you on a regular basis. And hopefully, everybody gets a little benefit from these videos that we do.
Absolutely. Thanks, Jim.